you understand how healing works? By understanding the process, we can not only heal ourselves, but understand why. Welcome to the Healing Power Hour with host Suzanne Hill. In our program, we will show you the healing modalities and approaches that you can use to heal yourself, no matter the illness or the symptoms. Now, here is your host, Suzanne Hill.
Hi, everyone. This is Suzanne Hill, and welcome back to the Healing Power Hour. Thanks so much for tuning in. Today, we have a highly informative show for you that most people will find applicable to themselves or someone they love and care about, and that's the topic of joint pain and arthritis. I wanted to cover this topic because it's one that many listeners have asked me about. And by the way, on that note, a Healing Power Hour fan page does exist on Facebook, so anyone who'd like to request that a particular topic be covered, you can do so on that page, and I'd be more than happy to meet your requests. So my guest for today's show will be the critically acclaimed Tai Chi master, Master Yang of New York City. I had the good fortune to meet and study with Master Yang up at the Kripalu Institute in Lenox, Massachusetts, when he was giving a retreat there back in 2011. And the first thing I noticed about Master Yang was that he's a very powerful energy, the kind that only comes from years of experience and practice. But he also has an incredibly kind and generous soul, and Master Yang is one of those people that we're lucky to have on the planet because he's truly interested in teaching and sharing his extensive knowledge with everyone. Master Yang was born in China with a congenital heart condition, which was life-threatening, and at the age of 12 he began to study Tai Chi and was eventually able to not only improve his health, but also heal his heart condition without surgery. It's an inspiring story because it's true, and so Master Yang will be joining us at about 20 past the hour to share his story and also share the many wonderful benefits of Tai Chi and Qigong. So before I bring Master Yang onto the show, I wanted to speak about today's topic, joint pain and arthritis. While all arthritis is joint pain, not all joint pain is arthritis, but I did want to address both of them in one show because both include pain, stiffness, aching, and swelling in and around one or more joints. And as an acupuncturist, when I address either of these, the energetic causes of both are similar, and we'll get to that in a bit. And just to be clear, some people experience joint pain because of things like bacterial infections, Lyme disease, and parasites, and those issues will be outside the scope of today's conversation, but I just wanted to mention it because those are things you're going to want to rule out if you do experience joint pain that doesn't seem to be relieved by standard measures. Now, when we talk about arthritis, we're talking about an estimated 50 million adults in the United States, which translates to about 1 in 5 adults. That's a pretty high number. As well, nearly 2/3 of people with arthritis are younger than 65, and that includes approximately 300,000 children. So it's not just a disease of the elderly. But what I want listeners to understand is that arthritis and joint pain are not your destiny when it comes to aging. There's actually quite a lot you can do to prevent it and heal it. I'm not going to go over standard Western protocols for arthritis because you can get that from your internist, but I do want to teach you some alternative ways of looking at joint pain and arthritis so that you can go deeper in your healing if you've already been trying to tackle this issue with limited success. Okay, just to give you a different perspective on how to view arthritis and joint pain, from the Chinese medical perspective, we call these diseases B syndrome. That's spelled B as in boy, I, B syndrome. And the word B in Chinese medicine means blockage or obstruction. And it's called this because the ancients determined that it is blockage or obstruction in the energetic pathways of the body that can cause the qi or energy in the body to become sluggish or slow. And it was believed that this obstruction would eventually cause pain in the joints. So what causes the obstruction? Well, the ancients believed that it was primarily what they called pathogenic factors. And the pathogenic factors, i.e. those factors creating pathology or illness in the body, these pathogenic factors are wind, cold, damp, and heat. And any of these pathogenic factors of wind, cold, damp, or heat, either individually or in combination, can cause B syndrome. And you can differentiate these different pathogenic factors in Chinese medicine not only through a patient's symptoms, but also through their pulse. So when wind, damp, and cold in combination, or wind, damp, and heat in combination invade your body, as they say, then B syndrome can occur. And through the pulse, you can determine which factor is most predominant. So for example, if wind is more of a factor than either cold or damp, then the joint pain will tend to be wandering. One day it's in the elbow, the next day it's in the wrist, the third day it's back to the elbow, and so forth. On the other hand, if cold is more of a factor, then you'll tend to have sharp stabbing pain in one or more joints that's fixed. It doesn't wander. And if damp is more of a factor, then you'll tend to have joints that are heavy and swollen, and that pain is aggravated in damp weather. That's why some people with arthritis always know when a storm is coming. It indicates that they have damp in their joints. And lastly, if heat is a primary factor, then there will be swelling and intense pain. But the onset of that pain usually comes on all at once and will less likely be a gradually progressive type of pain. So that might be interesting to hear about, but if you're not a Chinese medical practitioner, what use then can you make of this information provided by the ancients? Well, for one, these different causes of joint pain explain why some people experience pain relief with heat and some do better with cold. Because if cold is at the root of your issue, then icing is probably going to make your pain feel worse, and heat is what's going to bring you the most relief. The reverse is also true. If heat is your issue, then you're most likely going to experience pain relief with icing, which is cold. And these pathogenic factors also explain why your parents or grandparents might have nagged you to change out of your wet bathing suit as a kid. They had good reason. If the cold and damp settles into the deeper tissues of your body, it can ultimately settle into your joints and cause blockage and therefore pain. And for those of you who walk out of the gym after working up a good sweat and walk home instead of taking a shower straight away, know that you're also putting your body at risk for the same thing happening. Because as the damp and cold settle into your muscles and bones from your wet clothes while you're walking home, even if the weather's nice, if a cool breeze then blows across your body, you're setting up an ideal situation to obstruct or block your qi. I had a patient, for example, just this past Monday come in where we figured out that her super tight neck and upper back muscles were coming from her habit of walking home in the middle of winter immediately after sweating up a storm in spin class. She just wanted to get home and take a shower in her own home as opposed to the gym. But even in the 10 or 15 minutes that it took her to get home, this practice of not showering right away was really creating some extreme tightness in her upper body because of the cold and damp absorbing into her tissue. So we agreed that she would at least dry herself off at the gym and change into fresh, dry clothes for her walk home so it wouldn't happen again. And I'm 100% positive she won't have a repeat experience of extreme tightness next week. So we'll look forward to that. But don't get me wrong, I'm not saying that several times of doing that will give you arthritis, but for sure years of doing such a thing can absolutely aggravate and help create joint pain. If you happen to have a type of profession where you're exposed to extremes of temperature, maybe you're a fisherman, maybe you work at a job where you have to regularly go into a cooler, or maybe you just work in an office where they keep temperatures severely cold, then one of the things you're going to want to do for yourself is to keep yourself hydrated throughout the day with warm fluids and foods that contain things like cinnamon, cayenne pepper, and ginger, because these herbs increase circulation in your body and keep your internal body temperature warm. And by the way, this notion of pathogenic factors is also why you don't want to sit in the direct flow of air from an air conditioner, even if it feels delightful in the middle of summer, because if that wind penetrates your joints, it can cause pain. And again, over a number of years, this can lead to arthritis. Now, because B syndrome or joint pain and arthritis is a function of blockage of energy or qi, acupuncture is extremely helpful in not only relieving pain from these conditions, but acupuncture can also help clear the pain altogether. The needles stimulate the free flow of energy in the body, and this brings more circulation to the area, so more nutrients will get to your joints and cells, and more toxins will be able to be removed from these areas as well. And improved circulation is generally the key to all healing. But if you've tried acupuncture for your joint pain without success, there are two other areas you want to look at. The first thing you want to do is to begin to detox your body, because most arthritis sufferers have been found to have systemic inflammation. Even if you only have pain in one joint, let's say your knee, you're going to want to start detoxing by cleaning up your diet and getting rid of all bad foods, especially sugar, because sugar exacerbates inflammation. You're also going to want to do a colon cleanse, because whether you do it herbally or you go in for colon hydrotherapy, as we discussed in an earlier episode, a blocked colon will minimize the absorption of proper nutrients that your body needs to heal. As well, what I found in patients is that any obstruction or blockage in the lower intestines will block energy flow to the legs, and this can help cause knee, hip, and ankle pain. Lastly, you're going to want to do a liver cleanse because the health of your joints is intimately tied to the health of your liver, and many people find that after several liver cleanses, their arthritis and joint pain gets much better. So the first thing you're going to want to do is detox, and I'll go into the details of that, how to do that in an upcoming show, but I did want to address it briefly here. And the second crucial step you want to take if acupuncture hasn't been successful for your arthritis or joint pain is that you want to look at whatever negative stored emotions may be in your joint or joints causing you pain. And this is a very important point. As an acupuncturist and healer, I found that there is a strong emotional component to joint pain and arthritis. So please do start investigating within yourself if you have chronic, relentless, debilitating pain and you want to experience relief. You see, emotions have a strong impact on the flow of energy in our body. Positive emotions like joy, happiness, and love have the effect of expanding our energy and allowing the free flow of energy in our bodies, which translates into free flow of blood and lymph. On the other hand, negative emotions such as anger, betrayal, and sadness, to name a few, have the opposite effect. They contract the energy in our body and impede the free flow of qi, therefore they impede the free flow of blood and lymph. And because the key to healing, no matter what your condition is improved circulation, you're going to want to look at what negative emotions you might be harboring within yourself or absorbing from those around you that might be negatively impacting your body. Just to give you an example, I had a patient who had chronic stabbing pain in her left wrist and thumb. Her name was Jane. And we treated it with acupuncture for 5 or 6 times, which always helped for a few days, but then the pain would return. Now, this concerned her because she was only 40 years old and didn't want it to get progressively worse as she aged. And so as an empath, when I put my hands on someone's body, I can feel what emotions are stored there. And when I tuned into the energy of Jane's wrist and thumb, what I felt was both anger and sadness about a situation that she couldn't control. In talking about what emotions, emotions might be coming from, what came up was that she was extremely upset about a family situation. She was upset how her young niece was being neglected by her sister, the child's mother, and this neglect that she was witnessing called up for her the neglect she had experienced in her own childhood, which made her unbelievably sad as well as angry. So we discussed how Jane's niece would actually be okay because the neglect wasn't actually so severe, and also it's one thing to witness someone else's suffering, but it's quite another thing to take on someone else's suffering onto yourself. And so lucky for Jane, she was able to make that connection in just one treatment, and her pain went completely away. She did tell me on a later occasion that every once in a while her joint pain would flare up, but it was always in connection to witnessing this neglect, and when she caught herself and shifted her thinking in the moment, the pain would almost immediately subside. Now, I'm relating this story to you because it simply and cleanly illustrates how negative emotion trapped in joint can cause extreme pain. And it also shows how our thoughts and the way in which we see the world creates a large component of our health. So again, acupuncture will give temporary relief for arthritis because it increases circulation to and around the joints, but to get complete resolution of pain, it's often, not always, but it's often necessary to get to the underlying emotions that are trapped there that are blocking the flow of energy. Well, I'm sorry that we're out of time. We had some technical issues, so I can't get to some supplements that I wanted to talk about, and I will list them on my Healing fan page. I'll just say quickly, the one thing you want to look at is systemic enzymes, because systemic enzymes can break up scar tissue that can create pain and inflammation. I'll list those on the fan page. And the other 2 herbs you want to take are boswellia and turmeric. But that takes us to the last thing you want to do for arthritis or joint pain is you absolutely want to engage in physical activity if you can. For some of you, that might seem impossible given the amount of pain you're in, but that's why I invited Master Yang on the show to talk about Tai Chi and Qigong, because they're 2 things you can do to heal your body even if you are in incredible pain. So with that now, we're going to go to break, and when I return, I'll be joined by the esteemed Master Yang, who is a Master Tai Chi and Qigong teacher. Thank you. Hi, everybody. Welcome back. This is Suzanne Hill, and I'm now joined with Master Yang, Master Yang, actually. Welcome, Master Yang. How are you today?
Very good. Thank you.
Thank you so much for joining us. I wanted to ask you to start off by sharing with listeners your own personal story. I mentioned a little bit of it in the beginning, but if you could give us a little detail, that would be great.
Well, I was born in 1961. That was a very difficult economic time for China. So lots of the people could not get enough food to eat. And we know one of the consequences for the new babies when the mother did not have enough food to eat is a heart condition. So I was born with congenital heart condition due to the poor economic time and the nutrition of my mother. Then when I was 12 years old, I started the training Tai Chi, and when I was about 16 years old, I went to the National College entrance exam and did the physical and find out my heart condition was gone, which really boosted my confidence, and I continued to practice from there, and also went on to get the national or university competition in martial art in the Tai Chi division. So that completely changed my life. And now I'm applying this art to help other people too.
That's fantastic. What is the thing that you want listeners to understand most about Tai Chi? I know you teach so much, but why do you feel it's so important for people to learn?
You just mentioned in the show, for the emotional part, I think, from Tai Chi Qigong practice, we address this issue from two angles. One is spiritual practice, and the second is mental principles. For instance, the case you just mentioned, the Jin's case, and then first thing is to practice acceptance of reality. And what happened in the past, we cannot change. We just accept that. But that doesn't mean we let negative things run over us. We accept, and then we figure out what is the best way to help her nephew. That's just a simple example. So that's the acceptance of reality, and which we turn adversity to even opportunity to help more people. In this case, she can use her experience to help other people. And in addition to this emotional practice, and you also use physical movement, simple but profound physical movement to strengthen the qi and to balance the body.
Now, is it important to take a class to learn Tai Chi, or is it something you can learn on your own, like a video?
I would recommend to find a good teacher, and videos can be a supplement things to work with. But again, find a good teacher is the first step.
And how do you go about finding a good teacher?
Well, you can look at one of the criteria I recommend to look at the teacher is to see whether this teacher has complete traditional curriculum, which means it should include Qigong. And speaking about the Qigong, people should include static, which is a standing, sitting, lying down meditation. Then on top of that, you have gentle, simple movement to cultivate more benefits.
Now, you mentioned Qigong. Can you explain for listeners what the difference between Tai Chi and Qigong is?
Qigong is the Qigong means the art of cultivating our energy. There are two ways to practice. One is to use a static position, like a standing, sitting, lying down position to cultivate the qi. The second one is dynamic, basically is using movement. There are different kind of movement you can try. Tai Chi is one kind of moving Qigong exercise. It's just a movement with choreography. So the simple answer is Tai Chi is one kind of moving Qigong, and Qigong is the big umbrella concept.
Mm-hmm, mm-hmm. And what made you pick Tai Chi over Qigong for your studies? Or is that not an accurate question?
Oh, what's again? Sorry.
What made you choose to study Tai Chi over Qigong? Because they mentioned Qigong masters or Tai Chi masters. What made you choose Tai Chi over Qigong?
Okay, let's say this. If you have the traditional practice of Tai Chi, you should start with Qigong. Again, Tai Chi is one kind of moving Qigong. Another simple way to see that is you need to start with standing, sitting, lying down meditation to build up the energy before you do the Tai Chi movement. And to give you a simple story, like when I did my first 10 years practice, I only did the Tai Chi form, which was good and provide me with essential benefits, which is strength, flexibility, that kind of benefit. But after 10 years practice, I got a chance to meet one of the top grandmasters in Chinese martial art, who is a Tai Chi Qigong grandmaster. While I was doing the martial art practice, I was, in my 20s, and he was about 60 years old. And then the power, the vitality he demonstrated and told me just my movement was completely empty. And then he told me, I asked him, how can I get your power, your vitality? And he said, you need to start with Qigong, which means start with standing, sitting, lying down meditation, which significantly improved my practice.
Now, how much time a day do you spend now, and how much did you spend as you were learning Qigong and Tai Chi?
Myself now, I spend about 2 hours every day to continue to deepen my understanding of this art. Again, I'm a professional practitioner, but for average people to get the simple and profound health benefit, I would say start with 20 minutes every day, and gradually you can increase to like 30 minutes, or if you have more time, you can spend a longer time to get benefits.
Now, here in New York City, sometimes 20 minutes seems like a long time. Will a patient experience benefit if they do only 5 minutes a day?
Yeah, 5 minutes is better than nothing. Depending on what kind of situation you have. For example, if you have, I often work with patients or clients, and they have severe insomnia. And my recommendation is I ask them how much time they lose in their daily insomnia. And they said, at least 2 hours. I said, just give yourself 30 minutes to practice. And then it's a very simple math. You practice 30 minutes, and to deal with your insomnia, you sleep much better and then become more productive. I would highly recommend to start again with 20 minutes. Again, it's about quality longevity, and 20 minutes, it's a very small thing, but I think it's a very important investment to your health, mental, physical, and spiritual.
So in order to get some basic Tai Chi and Qigong movements down, how many classes would a person have to take? Would they have to take 6 or 10? Not to become a professional like you, of course, but just basic moves for their health. What would you recommend?
I would recommend a weekly class and between 3 to 6 months to get some basic practice. And you can practice on your own, and then once in a while you go back to the school to let the master to give you some advice to improve.
Fine-tuning?
Yes.
And how soon are positive effects felt when you start practicing?
I would depend on what kind of outcome variables you are looking at. Some are very quick. For example, the negative emotion you just talked about. Let me give you an example. You can get the benefit even the same day. At one of my regular class, and one of the participant come back to me after the 1 week class. She said, "Oh, in the past week you helped me 38 times." I said, "Why? How you can't get that number?" She said, "I have one of my colleagues have been driving me crazy for 10 years, and then I have been practicing the principles you talk about during the class, which is everybody is different, and nothing is personal." So, and then she said, after the class, I wrote these 2 statements and put that on my desk. Whenever this person came to my desk, I said, well, this person and I, we are different. It's not that she's correct, I'm correct, and nothing is personal. If she drives me crazy and she's going to drive everyone crazy, I am taking that personal. It is my problem. That indicates the area I can improve. So she said this person showed up in front of my desk for 38 times, and every time I mark it, so it significantly changed my mental and spiritual well-being there.
That's a great story.
Research, for example, I give you an example like immune function. I did one pilot study to look at the Qigong and Tai Chi practice on the immune response after people got flu vaccine. After 3 weeks, we saw significant improvement in the immune response due to the Tai Chi and Qigong practice, but it is a very small sample, and we need look at big samples to confirm the benefit, but at least it's point out the direction. Maybe 3 weeks or 4 weeks practice, it may improve your immune function.
And when you say improved immune function, what factors are you looking at to assess that?
We were looking at the HI titer, the response, after the flu vaccine, and we saw the Tai Chi Qigong group was significantly higher than the control group, which were doing conventional exercise. And so that's the outcome variables we're looking at.
Oh, that's an excellent study. Are you looking to repeat that in a larger group?
Yes.
And when you say small group, how many people were in that original study?
I had about 40 people.
That's still a pretty decent size. So one thing I wanted, because today's show was on arthritis and joint pain, I remember when I took class with you, you had talked about having back pain at some point, and I was wondering if that fits in the category. I know at some point you had severe back pain that you were looking to heal with your Tai Chi and Qigong. Can you talk a little bit about that?
Okay. In general, pain, arthritis, because you talk about arthritis. I want to mention, from research-wise, there were a couple studies demonstrating Tai Chi and Qigong practice might help the pain in arthritis. And for myself, and also the general practice in China, the overall the pain issue, there's a very famous statement that said, 不通则痛. Basically what that means from Chinese medicine, that means if you have blockage and you might have pain. So what causes blockage? One is the insufficiency of energy. Second is the blockage, which causes the blockage is mental and emotional and physical. So if you deal with pain, we want to work on from these several angles. For example, for the emotional part, you practice accept reality and deal with reality and cultivate positive thinking every single day to deal with stress. I want to back up a little bit to say in the Chinese medicine practice or spiritual practice, we say when you have a stress, it's a wonderful opportunity for us to improve us. It indicates the area we have issues we can improve, and then we accept the reality, and then we are happier and we have a tranquility in our daily life. Just from that point of view, you decrease stress and your pain might get better. Second, physical-wise, if you practice relaxation like a standing, sitting, lying down, it's a very effective way to deal with the physical tension. And when you reduce your physical tension, you can significantly improve the circulation of your energy, and of course, your pain will decrease.
That's true. You make it sound so easy.
Oh, it's easy, but it's simple, but it's a daily practice.
It's a daily practice. That's why they call it spiritual practice. Well, we're going to go to break soon, but when we come back, if you don't mind sharing your story about your back pain, I think listeners might like to hear that, because I was moved by your story, and I think it might give inspiration to other people who are suffering. So thank you for listening, everyone. I'm here with Master Yang, Tai Chi Master, and after break, we'll come back to talk some more. Hi, everybody. This is Suzanne Hill. You've joined me, and I'm discussing Tai Chi and Qigong and the benefits of these with Master Yang, Tai Chi Master here in New York City. Welcome back, Master Yang.
Thank you.
I wanted to start this segment with you talking about the back pain you had experienced, I think, later on in life, and how you also had healed that with Qigong and Tai Chi. Would you mind sharing a little detail about that?
Of course. And then, well, back in 2005, I went to swimming one day, and the swimming pool was empty. Nobody was there. And I jumped into the pool. I said, well, I'm so lucky. So without warming up, I started doing my butterfly. Very quickly, I feel, I could not move my body. And actually, I was paralyzed for 3 months. I couldn't move. I was embarrassed as a Tai Chi master. I said, I hurt myself so badly. And I was trying different things. I got panic, actually. And then I was trying to figure out how to get out of this pain. The more
when you
panic,
say, can I just
yes,
interrupt you for a second? When you say paralyzed, do you mean that you were just stiff as a board? You couldn't bend your back?
I couldn't do anything. I couldn't bend. I could not get up, actually. I was just laying in the bed. I cannot do anything. And I was embarrassed because I have more than 100 Tai Chi Qigong students, and then they were looking at the masters and laying down there. And then I would say, how can I turn this to an opportunity? How can I learn this lesson so I can share with my student? I look at my practice. I noticed one fundamental practice from Tai Chi, which is lying down Qigong. I have been neglected for a long time. And then, so that is an extremely important practice to relax your body for injury prevention. So I did not practice that part for a long time. And so my body was tense. So first I bring that part back to my practice. Another thing I learned is be patient. And then when you have pain, and then you have the belief that your body will have the ability to recover. Actually, this advice was from a very dear friend who is a wonderful healer. And then I said, well, I'm going to have this faith that my body will recover. And actually, in the meantime, one of the doctor told me, say, hey, you are going to live with this pain for the rest of your life. I said, I don't believe that. So, and then I just practice every day, practice the holistic curriculum, and like a standing, sitting, lying down meditation, and gradually, a little bit by little bit, I recovered myself 100%. How long it took me? 5 years. So here is one advice I want to share with our friends, our listeners there. When you have pain, be patient, accept that, and deal with that effectively, and find out best method to deal with your specific pain. Again, be confident your body will recover.
Now, how is your back today?
Very healthy, knock the wood.
And what did the doctors, when you went to medical doctors, what was their diagnosis? Could they explain why your back wasn't
They gave me
healing?
different kind of diagnosis. They said you need a surgery, and then all different kind of recommendations. I said, well, I also went to acupuncture doctor, massage therapy. I tried everything. But I think the most important thing is to have this strong belief our body will recover. In the meantime, be patient and moderate to do any exercise. Keep moving, but be gentle. And gradually, and then to let your body recover. Speaking of that, actually, most of the top grandmasters in Chinese martial art history, they started the training because severe health condition there. So, and then you work with that, your body kindly and patiently, and your body will recover. Yeah.
I do think that for all masters in whatever field of work you're in, I think all masters are put to a challenge sometime in the course of their profession, specifically because that is what creates the mastery within them and takes them to a new level. So kudos to you for being able to heal that within yourself. Now, when you talk about that you had this strong faith that you would get better, can you elaborate a little on how you were able to do that? Because it's easy for us to say to someone else, don't quit, but how were you able to muster up the strength within yourself on a daily basis to say, okay, keep going, keep going?
Well, Chinese, the Chinese word for adversity means is Weiji, means adversity also means opportunity. So I said, how can I take this pain incident, injury incident, to an opportunity to learn how to deal with pain and how to relax my mind and body to deal with pain, and a little bit you feel you can recover, and then sometimes you do have setback. And I had several occasions, and I feel, I'm strong, and I'm strong again. I can do more vigorous things, and boom, I had a setback. And then keep working this back and forth. Again, that teaches you how to be kind to your body and using nurturing approach to recover and to build the vitality. There's one big difference I noted between our two cultures. In this country, and people strongly believe in no pain, no gain, or some of the people believe that. But in China, we believe no pain, more gain. How to nurture our mind, body, and spirit to accumulate the energy to become stronger instead of torturing our body. You are going to end up with different kind of pains and become more and more pains. So that's one thing I want to point out.
I like that. No pain, more gain. I like that. Now, at any point, did you consider having surgery?
I was considering to have surgery. Of course, when you have severe pain, you say, well, maybe I should take that option. But I was convincing myself, no, let me give a try without the surgery and see what happened. I'm not saying don't have surgery when, there are certain conditions you do need surgery. But I would say most of the time when you have the pain, try the non-surgery approach and see what happens.
So thank you for sharing that. I'd like to also ask you if you have any case studies or patient-student stories that stand out for you that you'd like to share with listeners for their healing.
Well, I do have one of my current student at the 92nd Street Y class in New York. This friend, I've been working with him for several years, and he came to me for pain relief. And after I showed him the exercise and he practiced, and then he stopped. And 2 years later, he called me and said, I have acute pain. I cannot move my body. Can you come to my house? I did. And I started working with him. And again, now.
Where did he have the pain?
Back pain.
Back pain. Mm-hmm.
Actually, also neck pain too. And then now he stopped the injection of the different things, and now he is completely pain-free. And now the only difference he's making there is practice every day. But you don't have to spend an hour to practice, just 20 minutes. And in a long run, it is very significant. But the small things, daily small things, it will accumulate and you will get the long-term benefits.
That's a great story. So we do have a lot of listeners who live in New York City. So where can people take classes with you?
You can go to my website, which is centerfortaiji.com. The Taiji spelled as TAIJI. Aiji. If you go to New York City class, you will find mainly like I teach a Sunday class in downtown area. And also I'm working with cancer patient survivors at Memorial Sloan Kettering Cancer Center. And also I have a class at 19th Street Y. But again, my main practice is doing research. I want to find out what is the mechanism and the effects of this ancient practice. I only teach part-time, but these are the places I'm teaching.
Oh, that's great. And the funding for the research, are you getting that through the university or is that private funding?
The funding I got during my dissertation back at University of Illinois was from the university. Now we are working on applying funding from different foundations and places. Yeah.
Oh, good luck with that.
Thank you.
And can you tell us a little bit about your book? You wrote a book, which I actually gave to my parents for Christmas one year. Can you tell us about the inspiration for writing your book?
There are several motivations for me to start that work. And first, I feel if Tai Chi and Qigong can help me so much. Actually, I was banned from physical activity class when I was a kid. And then now my health improved so much. And I said, if Tai Chi and Qigong can help me so much, I would like to share with as many people as possible. And the second, I've been studying with some of the top grandmasters. And what that means is I learned some of the essential practice, which some of them have been missing in the general public. I do want to share that part and to give that out to people to get the health benefit. The third one is I look at the Tai Chi books in Chinese. Most of the Tai Chi books, it's kind of like esoteric. I say, well, as a Chinese, if I don't understand the books in Chinese, how can Americans understand after that translated into English?
Sure.
That's make me to think about how can we explain each of the essential practice in a scientific, common sense language, so everybody can understand why we practice which component to deal with different health issues. So, that's really making me to think about, and then I need to get a book out to explain this ancient practice so more and more people can get the benefit.
That's great. What do you have other materials for people to learn about Tai Chi? They can read your book. Do you have videos up?
Yes. During my dissertation, I did my doctoral program at the University of Illinois. Basically, my research was to helping seniors to deal with their balance, immune function, cognition, and these different issues there. So I did several randomized controlled trial and published them on scientific journals. And then from that project, I had a program called Evidence-Based Tai Chi and Qigong, and it's a DVD and also combined with meditation music. It's on my website. It's called the Evidence-Based Tai Chi and Qigong. The meditation music is called Elixir Field. So you can find this material from my website.
That's nice. So we just have a couple more minutes. I wanted to ask you, is there any last thing that you'd like for us to learn about Tai Chi? Is there any last thing you'd like to share?
I say yes. The things I want to share with everybody is let's focus on daily mental, physical, spiritual practice to cultivate beauty and happiness and vitality. You don't need a lot of time, just to spend 20 minutes, and in the long run, you are going to have quality longevity and also pain-free and stress-free. That's my hope.
That's a beautiful thought. Well, I know that I teach meditation classes once a month, and I incorporate some of your techniques into the beginning of the class because I find that once people start to do the Tai Chi, they can actually start to feel the Chi, and that gets them excited to know that the Chi actually exists. And I incorporate a number of exercises from different places, but I have to say the ones that I learned from you are the most powerful, and I don't just feel that, everyone feels that, so I wanted to give you that feedback. And so anyone listening, if you have an opportunity, please Google Master Yang on the internet. And what your website again was?
Centerfortaiji.com.
Center for Tai Chi.
Yeah.
And with the Tai Chi
is spelled as TAIJI.
Great. So you can go on to that website and do some research. And if you live here in New York City, please feel free to take a class with Master Yang. Even if you can only take one class, it's definitely worth your while to experience his energy. And as you can, I'm sure, hear over the radio, his gentle nature and his inspiration. Thank you so much for being with us today, Master Yang. I hope you have a good day. And to my listeners, thank you so much for tuning in and listening. As I always say, please make use of what you've learned today, and much love to you all.
Thank you so much for joining us this week. Please join Suzanne Hill for another edition of the Healing Power Hour next Wednesday at 11 a.m. in the West, 2 p.m. in the East on the Voice America Health and Wellness Channel. Have a healthy week.